probably a little early to see the U.S. turning the corner now in terms of the number of cases. I do think we're much further into this than we are detecting. So I think that we're going to see a Delta peak. If we're already seeing healthcare systems get saturated in certain states like Florida, against the backdrop of a lot of the vulnerable population being vaccinated, so you're seeing less older Americans turning up in the hospital, it's a pretty good indication that there's a lot of infection underneath those hospitalizations that we're just not detecting that's taking place in a younger population that isn't getting as sick. So I think that there are indications that we're further into this. A lot of the testing that's taking place also is Binax now, an antigen-based test that's being done at home and not getting reported. So we're not capturing all of our positive tests. A lot of the people who are becoming symptomatic are becoming more mildly symptomatic because they're younger people, or they're people who've been vaccinated and just become asymptomatic or mildly symptomatic. So those people aren't presenting for testing. So our ascertainment, the percentage of people who are presenting for testing and actually getting recorded, is quite low right now. So this infectious wave must be far more pervasive than what we're detecting, which means we're further into it than what we believe. I think the only challenge that I perceive is that we probably will turn a corner, to your point, sooner rather than later. You know, if you think over the next 2 weeks, 3 weeks at the most, we'll start to see this country turn a corner. Could happen a little sooner than that. But schools are going to be reopening, so we'll be turning a corner right at the point that schools start to reopen. And my concern is that the schools reopening could cause sort of a second bump in cases, or could look like a pattern where we start to see a decline, and then it levels out because the reopening of the schools becomes a source of local transmission, and we don't quite get out of it as quickly as we would have. So that remains to be seen. The kids will be sources of community transmission with such a contagious variant when schools reopen. So this may be a little bit more persistent for that reason. But otherwise, we're probably further through this Delta wave and probably have infected a good number of the people who have so far escaped infection and escaped vaccination.
Cases, because it seems like every day we're hearing more about breakthrough cases. Anecdotally, I now know people who have experienced breakthrough cases, both asymptomatically but also symptomatically. And in 2 cases, actually, they had a much tougher time than I was imagining. Somebody that had taken the Pfizer and Moderna, both the 2 steps. So the question is, how should the public be thinking about that? And you're talking about school reopening, and that could be an issue, but there's a lot of businesses that are planning to actually have close to 100% of their people back post-Labor Day.
Yeah, we're doing a good job tracking. The CDC is doing a good job tracking breakthrough infections that result in hospitalizations. And it's very clear that the vaccines are protective against severe disease that would cause someone to become hospitalized. The CDC is not systematically tracking breakthrough infections in the outpatient setting. I'm hearing the same thing you are, anecdotal reports of people developing either asymptomatic or mild infections, some cases getting a little bit more sick than that, despite the fact that they were vaccinated. You do see in Israel a growing number of breakthrough infections in their early data sets, and that's why we started the discussion around will we need boosters at some point, because when we look at the cohort from January, people who were vaccinated in January and February, what you see is declining vaccine effectiveness where people aren't getting very sick, they're not becoming hospitalized, the vaccines are still very protective against severe disease, but you are seeing symptomatic breakthrough infections starting to occur in an older population, which is the population where you'd first expect to see some declining immunity. Remember, there's 2 things going on. It's not just one thing. On the one hand, you have a vaccine that in some people is an older vaccine. They were vaccinated in December or January or February. And they may be an older individual whose immune system isn't going to develop as robust and as sustained an immune response. And then on the other hand, you have a far more contagious variant, 2 things moving at one time. And so you have a variant that's more likely to pierce prior immunity in this Delta variant. So you have both of these phenomena happening simultaneously. And so together, it wouldn't surprise me if on a systematic basis we do have more breakthrough infections occurring. We're just not tracking it, and we should be. And it's really discouraging that CDC isn't tracking this. The other critical question that needs to be answered, that we could potentially answer if we were systematically tracking this data as a nation, is if you develop a breakthrough infection, if you're vaccinated and you develop a mild or an asymptomatic infection, how likely are you to transmit that infection? We know from the old data that people who were vaccinated who developed mild or asymptomatic infections were far less likely to transmit that infection. But that may not be the case with the Delta variant, where you shed a lot more virus. And so if, in fact, you're more likely than you were previously to transmit the infection despite being vaccinated, and we don't know the answer to that question, that would inform issues like, could you take care of a newborn if you're vaccinated, or an elderly patient, or if you're vaccinated and not feeling well, should you get yourself tested for COVID? Because typically someone who's vaccinated wouldn't suspect that they would have COVID, even if they might develop mild respiratory symptoms. But in a setting where there's high prevalence, where a lot of people have the infection, where you have symptoms that could be consistent with a mild infection, where you're putting yourself in a situation where you might put others at risk, the prudent thing to do might be to also get yourself tested despite your vaccination, in the absence of information to really inform that scenario.
Yeah. Shepard Smith here. Thanks for watching CNBC on YouTube.